have been on the faculty at the Gestalt International Study Center in Cape Cod, Massachusetts for probably 20 years now. And when the founders, Edwin and Sonia Nevis, it was time to sort of pass things on to the next generation, I was identified as one of the next gen folks. And we wanted to learn different things. The cycle of experience is a key lens that Gestalt folks use. And Mike Stern developed 5 Dynamics. It uses the cycle of experience. So he came and did a certification program with the folks who were part of the next generation. And I've been a 5D fan ever since. I think of it more as an assessment tool of sorts, you know, in the organization development world. So how I compare it to Myers-Briggs or the Hogan personality test is that, one, it's really not about your personality. It's about how you approach work, how you approach learning, how you approach collaboration. And just that alone makes people more relaxed. They don't get as defensive. They don't feel like they're being put into a box. So that's one of the things that I really, really like about it a lot. 2, the validity is very high. It's really well researched. And I believe the validity is higher than just about any other assessment tool that I've used. Other thing that I like or love actually about 5 Dynamics is it's so quick. You know, you don't have to take 20 minutes to a half an hour. I mean, some of the assessments I use take an hour and 20 minutes. So I work with a lot of folks in healthcare, a lot of physicians, a lot of clinical people where time is sparse, to say the least. So the fact that it takes under 3 minutes is, I never get people pushing back and complaining. I have used it a lot with individuals, used it a lot with teams and with organizations. And primarily, I work a lot with healthcare teams. So for example, I was at the South Central Foundation for a couple of years. So integrated care teams, like a primary care team. So you've got your provider, you know, you have a nurse, you've got a scheduler, admin person, you might have a behavioral health person, might have a pharmacist. So in healthcare, people traditionally have been very siloed, and their idea of team is what I call parallel play, or sometimes it's, you know, cutting up the wedges of the pie. So they really don't have a good sense of what it's like to truly be integrated. And because of all the changes in healthcare, they need to work that way now to survive without burning out and to provide the best care. And 5 Dynamics has just been an absolutely phenomenal tool, just totally phenomenal. So one is people understanding themselves. I think that's always where it starts, is with self-awareness. And the descriptions are like spot on for people. You know, they think somehow you got into their brain. But I teach them the cycle, and I always have them do some exercises, and they can start, it comes alive. So, you know, that's where with you folks use it as a process map. So we use it as a process map. And then when the team is overlaid, you know, you get to see the value that each individual brings to the team You get to see their strengths. You get to see if there are any weak areas that they're going to have to shore up. So it's truly a wonderful team. And I have seen teams go from barely working together to this is really transformational. You know, it's not unusual for teams to have me come back a number of times, you know, to give them booster shots in terms of how they can maximize the benefit of their dynamics. So the second way I use it, I work a lot with executive teams, and now it is just part of my protocol. And again, you've got busy people. It's quick. It's almost self-explanatory. People can see it and you can apply it right away. So if I'm working with the team, everybody's got their own report. Everybody's got their 5 dynamics with the team. We go to work and we talk about, when I intervene with the team, we use the cycle as the lens that we look at the team through. Everybody on a team brings gifts. And, you know, I work with physicians, I work with scientists, I work with engineers. They are not people who are, there are exceptions, but they don't typically gravitate toward the relational or things that they consider soft, touchy-feely. Yet they need to work together as a team. So that's where I find 5 dynamics really, really useful. Like I said, it's quick. These are busy people, so they don't push back. It isn't like they've got to go to this training program first, and now we can apply 5 dynamics. It's immediately we can hit the ground running. And I always use it in the context of work that they have to get done. And it accelerates. It helps them leverage their strengths, work around any deficits they have as a team, and really value each other's differences. Working with a primary care team, so I observe these teams as well. I try to see what they look like in action. So with this team, so it was a physician, a nurse, and kind of a scheduler, administrator, and they had a behavioral health person. And they all sit in the same pod, you know, so it's a small area where they can all turn to and talk to each other. So when I observed this team, it was like being in a library. It was like as quiet as could be. You know, maybe the CMA, who's a certified medical assistant, would say something to the physician, you know, getting ready for the next appointment. Do you need this or that? But other than that, it was like dead silence. So I'm like, what is with this? Because half the reason that they put people in pods working together was so they could talk to each other. So when I did their 5 dynamics, what struck me was that with the exception of the provider, everybody else was high on excite energy. The doctor was reserved. The doctor's the leader of the team. Everybody else is at least deliberate plus. One person was actually abundant in excite energy. So I scratched my head and said to them, help me understand this. This does not make sense. What I'm seeing with you folks in action and what I'm seeing on paper. Well, it turned out because the provider is reserved in excite energy, they were all taking their cues from the doctor. They didn't think it was okay to talk. And the reason I was called in to work with this team is because communication was poor. So it was a great example of, one, people tend to mirror the leader. And two, because of 5 dynamics, we could make this dichotomy, we could bring it out into the open. They could have a productive conversation. Nobody got defensive. The provider said, you all have permission to talk to each other. So, you know, I came back 3 months later. Their service numbers were terrific. They hadn't gotten any complaints about missed signals. People were happier because they didn't have to sit on themselves all day long. So everything in the clinic just started to run better. And that actually included, you know, one of the metrics that they track is, are patients getting sort of things that they should be on a regular basis? You know, are you asking patients if they need medication refills? Are you making sure that, you know, you ask them about the colonoscopy or a breast exam, that people actually talk about these things? So even their patients were more satisfied because people were following up, asking more questions. So the other place that it really stands out for me, and I don't know if this is with one team or not, you know, it's working with clinical teams, because like I said, this is not something that they typically do. You know, healthcare is very siloed, it's very hierarchical, and there's often distrust amongst them. So to me, 5 dynamics, like in an hour and a half, you know, of working with a team, the trust level goes beyond, higher than it's gone in like 5 years in some cases. And that's on a pretty regular basis.